Hello everyone. In this video we will be discussing the INI CET recall biochemistry portion which was conducted recently on 17th of May 2025. The INI CET with biochemistry portion was from the previous year topics. Whatever we have covered in the last 3 to 4 years in the previous year topics, right? The questions was the options were little trickier, but the questions were from those topics only, right? So INICET is a very important examination, but इसको आप पकड़ के बैठे नहीं रहना है, हमें इसके टॉपिक्स उठाने हैं. Whatever was asked in the INICET in all the subjects, irrespective of the subject, in all the subjects, whatever topic was given, now pick those topics, study them thoroughly. Your next 1 week to 10 days should be only focus on the topics which were there in the examination. For example, if there was some drug which was asked, right, revise everything related to it, right? If there was something anti-cancer drug which was asked, revise all the anti-cancer topics, right? So the whole topic has to be revised. Similarly, we will be discussing in biochemistry also, you need to revise everything. So let's get started. Question number 1, IGF 1 and 2 is structurally similar to I'm sure you might have seen this question under physiology section also. This question is particularly belongs to physiology section. My purpose of showing you the structure is not to discuss what is the answer in detail, how we come to that conclusion, no. But my purpose here is insulin is a very important topic, and insulin we have studying major portion of it under biochemistry also. So because this time in INICET a structure related question came for insulin, you can get some other question related to insulin, related to biochemistry in the NEET examination or in the following INICET examination. So insulin is a very important topic. You might have understood that the answer for IGF 1 and 2 is structurally similar to insulin. The answer to this question, no doubt, is insulin. And there is a family of hormones which are insulin-like family, and that belongs IGF 1 and IGF 2. The insulin-like growth factors are around 7.5 kilodalton single chain protein homologues of insulin that promote cell growth, survival, migration, differentiation in vitro, and have insulin-like activity. It is formed from pre-proinsulin. The signal peptide is removed. Proinsulin is left, from which the C peptide is removed, and ultimately you get a 51 amino acid molecule, and that is your insulin. It has two chains, A and B chain, and you can find that there are interchain disulfide bonds and intrachain disulfide bonds. Now, coming to another question, this is a question from sphingolipidosis. I always say this is a last entry revision topic. If tomorrow is my exam, this is one such topic which I will be revising today. A 4-year-old child with normal startle reflex develops hepatosplenomegaly. The red area at the center of macula surrounded by a pale halo resulting in blindness was seen. Which of the following enzyme is deficient in this case? Probably, as I have got from the recall, exact term cherry red spot was not given, but it was pointing towards this cherry red spot on macula with hepatosplenomegaly. These are the two key features. Now, this of course is, you know the answer, you know it is sphingomyelinase deficiency, you know it is accumulation of sphingomyelin in the disease Niemann-Pick disease. It belongs to a larger disease, that is sphingolipidosis. It belongs to a still larger disease, the lysosomal storage diseases. Let's see the other options. Hexosaminidase A deficiency will result in Tay-Sachs disease. Sphingomyelinase defect results in Niemann-Pick disease. That is our answer for this question. And Gaucher's is beta-glucocerebrosidase or simply beta-glucosidase, that is Gaucher's disease. Aryl sulfatase defect will result in metachromatic leukodystrophy. I was having little confusion in option D because some of the students have told that it was Fabry's ka alpha galactosidase. If it was alpha galactosidase, still it is not the answer. Answer is sphingomyelinase deficiency. But if metachromatic leukodystrophy was given, then of course the enzyme was aryl sulfatase. But in case they mentioned about the Fabry's, then it was the alpha galactosidase defect. Now, in all of these sphingolipidosis, there are certain features which are common to all of them. But when you see this term hepatosplenomegaly, that is associated with Niemann-Pick disease and Gaucher's disease. No hepatosplenomegaly is seen with hexosaminidase A deficiency, that is Tay-Sachs disease. But characteristically here, if something like cherry red spot on macula or red area on the macula resulting in blindness is mentioned, that in particular can happen because of Niemann-Pick disease only, right? So let's revise all the lysosomal storage disease. This I want you to revise one day before your NEET examination. Lysosomal storage diseases. Hexosaminidase A defect is Tay-Sachs. Fabry's is alpha galactosidase defect. Gaucher's beta glucosidase defect. Metachromatic leukodystrophy is aryl sulfatase defect. Krabbe's is galactocerebrosidase defect, and Niemann-Pick is sphingomyelinase defect. Sphingomyelin will accumulate, and it is the only sphingolipid which has phosphate in it. So it is actually a sphingophospholipid. This was a previous year question. Crumpled tissue paper appearance is seen. It is beta glucosidase defect. And foam cells are seen in Niemann-Pick. This is a slide representing foam cells that is seen in Niemann-Pick disease. So if you have a cherry red spot on macula with foam cell, your diagnosis has to be Niemann-Pick disease. This is a foamy histiocyte and cherry red spot on macula that is seen in Niemann-Pick disease. Angiokeratoma are seen in, they appear like skin rash, but they are keratomas. These are seen in Fabry's disease, alpha galactosidase defect. Onion skin lysosomes is a biopsy finding for Tay-Sachs disease. So with this we come to another question. There was a graph given. This was a very simple question and I know all of you have got this right. pH of zwitterion as shown in the given diagram. All you have to do is, it's clearly visible here, pH is 5.97, right? Or what we can do is, we can take the, let's try and understand the titration curve. Glycine will exist in our system in three forms. In one form, it will have an overall positive charge. In the other form, there will be overall no charge, or the zwitterion that was in the question. And in the third form, it will be having overall negative charge. So it can be positive charge, it can be having no charge or a zero charge. We don't call it zero, but it is no charge, no net charge more accurately, and a negative charge. There are three forms in which glycine can exist in our body depending upon the pH of the surrounding medium. So pK1 is that pH at which it is the dissociation constant of the glycine at which 50% of the molecules are in the cation form and 50% are in the zwitterion form. pK2 is the pH at which 50% are in the anion form and 50% molecules are in the zwitterion form. At Pi, the buffering capacity of any amino acid is maximum. Usually when we talk about this buffering capacity, it is highest for histidine. But in the given question, they have asked about glycine. So for glycine, the type, according to this, the Pi of glycine can be determined by you have to know dissociation constant at A position, dissociation constant at B position divided by 2, and you will get 5.95. That was in the options, it was given as 6, and that is the correct answer. And I know you have no doubt in it. Another question, which of the following tissue will not be able to take glucose in insulin resistance in the absence of insulin or in diabetic population? The answer is C. What they want you to know is whether you know the difference between insulin dependent and independent. So whenever we talk about insulin dependent, we are referring to GLUT4 transporters. GLUT2 and GLUT4 is the most important topic under glucose transporters, but this time we will not leave any of the glucose transporters. So GLUT4 is present in skeletal muscle, adipose tissue, and it is present in heart. GLUT2, on the other hand, is present in liver, small intestine, pancreas, and kidneys. So GLUT2 is present in these many tissues. So if I have to choose amongst my answers, I will say GLUT4 is insulin dependent, and hence skeletal muscle will not receive glucose if something goes wrong with the insulin. You must have insulin. 2 different specimens from 2 different patients are received. Probably this was related to microbiology. There was a question, I did not get the complete question, but there was a slide showing Mycobacteria tuberculosis. So that was we will be able to differentiate whether we have got the specimen from the same individual or 2 different individuals according to the basis of RFLP. This can be a multiple choice question, but my focus here is that you understand what is RFLP. RFLP is a technique by which you are using an enzyme restriction endonuclease. This enzyme cuts the DNA at palindromic sequences, and the purpose of this enzyme is, naturally it is present to cut the DNA, but we are using it to differentiate 2 DNAs. Suppose if DNA 1 has a restriction endonuclease site, the DNA is getting cut in this form. Let's say DNA from individual 2 is not having this restriction endonuclease site. In other words, it will not get cut. Now when you will perform gel electrophoresis for this, the pattern will be different, and when you will perform gel electrophoresis for this, the pattern will be different. So I am able to differentiate 1 from 2 because now I can see that the gel electrophoresis is different. This means it is not from the same individual. So RFLP is used to detect whether we have got the specimen from the same individual or from 2 different individuals. Now this was an interesting question. 90 kg, everybody remembered the obese male was given and he was taking a carbohydrate rich diet. पहले ही 90 kg है, ऊपर से obese, ऊपर से carbohydrate rich diet. Of course 90 kg is justifying his obese. Then now he is taking carbohydrate rich diet. Which of these enzyme intermediates will be elevated in him? Malonyl-CoA. See, whenever the enzyme acetyl-CoA carboxylase is active, this is the rate limiting enzyme for fatty acid synthesis that will convert acetyl-CoA to malonyl-CoA. And from where are we getting this acetyl-CoA? From all the carbohydrate this individual is eating. that carbohydrate is getting converted to acetyl-CoA. Acetyl-CoA is more, so more will be malonyl-CoA. So in an obese individual, the circulating malonyl-CoA levels will be higher. This is true. Now, because acetyl-CoA carboxylase is present, is active in presence of the enzyme insulin, this will be active because he is taking a carbohydrate-rich diet, promoting insulin. Insulin will promote acetyl-CoA carboxylase. Even this is true. So there will be increased activity of acetyl-CoA carboxylase. And what was the enzyme which was immediate precursor is making acetyl-CoA? It is converting pyruvate to acetyl-CoA. None other than PDH. More is PDH active, more is acetyl-CoA getting formed. But when malonyl-CoA is accumulating, in the end, it will form palmitic acid, or you can say palmitoyl-CoA. That is the purpose of eating carbohydrate. Extra carbohydrate in the body, it's getting converted to fat. Whenever there is very high concentration of fatty acid in our body, palmitoyl-CoA is very high in the body, it inhibits the enzyme ATP citrate lyase. So find an answer in which 1, 2 and 3 is given. That is your answer. Palmitoyl-CoA inhibits the enzyme ATP citrate lyase, and that will be inhibited. Rest all the options will be activated. So fat metabolism is an important topic. Do revise this thoroughly for the examination. You will have to revise beta oxidation of fatty acids and the fatty acid synthesis, and that starts from glucose, because ultimately glucose is getting converted to acetyl-CoA, of course via pyruvate. Then another question, carbon monoxide and hydrogen sulfide inhibit the electron transport chain by which of the following enzyme inhibition? They inhibit the enzyme cytochrome oxidase. This is a repeat question. INI-CET November 2024. There was a question which said cytochrome C oxidase present can be blocked by all except. So carbon monoxide is an inhibitor to complex 4. Cyanide is an inhibitor to complex 4. Hydrogen sulfide is an inhibitor, but not nitric oxide. Nitric oxide is not an inhibitor of the electron transport chain. What I mean to say is it's a repeat question. Carbon monoxide, hydrogen sulfide inhibits the enzyme cytochrome oxidase, that is also known as complex 4. For NEET examination, electron transport chain, oxidative phosphorylation, their inhibitors, uncouplers, everything is important. Then another question, a child was normal till 6 weeks, after which he develops muscle weakness. At the time of presentation, he develops vomiting, diarrhea. In addition, hepatomegaly with more than 8% glycogen content is found. On further investigation, we find that hypoglycemia is seen. Upon glucagon administration, there is improvement in blood glucose level after a meal. However, there is no improvement in blood glucose after an overnight fast. His AST and ALT are found to be elevated. Ketosis is found. Which of the following is the enzyme defect? See, before I come to the answer, we see ketosis is present. Ketosis is found in 2 of the major glycogen storage diseases. And this is no doubt that it is a glycogen storage disease. He is saying that hepatomegaly with 8% se zyada glycogen content is found. Now, we have to differentiate between 1 and 3. 1 of course is von Gerk's disease and 3 is Cory's disease. Type 3 is Cory's. Von Gerk's is deficiency of the enzyme glucose 6-phosphatase. This results in severe fasting hypoglycemia because this is the terminal step, a common step to both gluconeogenesis and glycogenolysis. CoRES is a defective debranching enzyme. It is a defective debranching enzyme. Ketosis is found in both, but lactic acidosis and hyperuric acid is found only in von Gerk's disease. It is absent in CoRES. It is not even mentioned here. Now, the glucagon challenge test. We are giving glucagon and we are seeing for blood glucose. Agar glucose 6-phosphatase is deficient, even if you give glucagon, what it does is it tends to raise blood glucose by breaking down glycogen. We do not have the terminal enzyme. We will not be able to. It will fail glucagon challenge test. Here in the question it is mentioned that we gave glucagon but blood glucose came out to be, it was raised. It raised. That means glucagon challenge test is pass. That is difference between 1 and 3. That is used to differentiate between 1 and 3. So, if we are giving glucagon because the defect is in the debranching enzyme, glucose 6-phosphatase is present, jahan tak branch point aayega, till the branch point is reached, we will be able to cleave off glucose. After the branch point, we won't be able to cleave off glucose, and that is why it is a disease. CoRES is a disease. But in case of von Gerk's disease, the terminal enzyme is not present. Even if you are forming lot of glucose 6-phosphate, it cannot be diverted to glucose. Why? Because the terminal enzyme, and that fails to respond to glucagon challenge test. So if glucagon challenge test passes, it is type 3. If it fails, then it is type 1. Then there was another question, which of the following combination is correct? This is very easy. You know this. South Indians like dosa, North Indians like roti, Western people like pizza or pasta. So that is Southern DNA, Northern RNA, Western is protein. So it's good time for you to have a cheat day, go for your pizza or pasta date. But make sure that you are, just after the date is over, you are studying thoroughly for the next 1 month. Right? So yes, this is another important topic. Another important way to remember the same Southern blotting, Western blotting and all. Which of the following is true for glucose 6-phosphate dehydrogenase? Now, some of the students told me that it was not glucose 6-phosphate dehydrogenase, it was glucose 6-phosphatase. I'm a little confused. When you usually ask this question, it is asked in regard to glucose 6-phosphate dehydrogenase, because that is what results in hemolytic anemia. And hemolysis is associated with high indirect bilirubin, unconjugated, normal direct bilirubin, but increased urobilinogen. So this was a tabular type of a question where they were trying to ask you about hemolytic anemia. Gene pool. This is usually a class 12th question. It's a new question. Gene pool refers to the amount of gene present in the amount of whatever type of genetic material is present in a population. So that is the genetic material in the population. So that is the answer. And this was a very simple question. After every cycle, there will occur doubling. One will become, after one cycle, one DNA becomes 2. After second cycle, 2 will become 4. So immediately before this, 25 is the answer. That was half the number, and immediately one cycle ke baad it becomes the second half is generated. So based on the INI-CET, the most important topics for the NEET 2025 are insulin, alcohol metabolism. There was a question related to it in pharmacology. It was not in the biochemistry, but that can be asked. Alcohol is very important. Oral hypoglycemic agents, very important. Glucose transporters, PCR, blotting techniques, sphingolipidosis, glycogen storage disease, G6PD, amino acids, particularly glycine, sulfur containing and 3 aromatic amino acids, electron transport chain inhibitors and uncouplers. With this, I wish you all the best. Thank you so much, but make sure that you revise these topics thoroughly. Thank you so much. I wish you all the best.